Good evening, everyone.
This conference is no longer being recorded. This conference will now be recorded.
Good evening, everyone. Welcome to our Monday, April 6, 2020 Bladen County Commissioners meeting. Tonight we have 3 of our commissioners not here, but they're live and on the phone as well. Dr. Mungoins, Ms. Trivett, and Mr. Peterson, with the other 6 here in our room. At this time, we'd like to, before we have our prayer, I would like to just thank everyone for coming tonight. We thank our commissioners. We're going through a tough time, and we pray for all of our commissioners and all the citizens, employees of not only our county, but the state, the country, and obviously the world. But at this time, I would like for us to have prayer, and then Mr. Martin, if you would lead us in our pledge. Our Father, we thank you, Lord, for this another day, Lord, that you spared our lives through. We thank you for all the blessings, Lord, that you've given us throughout life. We thank you, Father, for the blessings that we know, Lord, that you're going to send our way to help us overcome this pandemic. Lord, we just pray that you would be not only with us commissioners, but our families, the people in our county and our state, and our country and all the other countries. We're facing something, Lord, that we've never had to face before. But we ask your mercy, Father. You're the only one that can take control. And you control the hands, Father, of all of us that can make a difference in this situation. We go with you now and ask your blessings and your guidance in this meeting that we're going to have tonight. In Jesus' name, Father, we do pray. Amen. Amen.
I pledge allegiance
to the flag of the United States of America, and to the republic for which it stands, one nation, under God,
indivisible, with liberty and justice for all.
Thank you, everyone, for that. It's time to approve our consent items.
Mr. Chairman.
Yes, sir.
Got one question on item 2P.
On 2 what, sir?
2P.
2C?
P, he hasn't Paul.
2P, yes, sir.
Commissioner Mungoins had a question regarding flags going to other towns. Have we resolved that?
I think Mr. Martin spoke with her about it, sir.
We replied an email. I actually copied all the commissioners on that to say yes, other towns are.
Okay, thank you, sir.
Yes, sir.
So everyone would be, if they need it or request it, it will come to the commissioners, and I assume that they will be approved. They will purchase them for them.
That's correct.
Motion to approve.
Thank you.
Second.
We got a motion by Mr. Gooden. We got a second by Mr. Cogdell. Any discussion? All in favor say aye.
Aye.
Opposed?
Aye.
Line item 3, individual delegations wish to address the commissioners. We have one, and that's Mr. Our county attorney, Mr. Johnson.
Your Honor. Your Honor.
I answer about anything. Ask my wife. Go ahead.
Mr. Chairman, with regard to line 6, I'd like to make a statement with regard to that. I don't know if I've talked about it. The hurricane grant funds, we've already closed. I closed the first phase of that. Second phase came out, and I submitted my statement. Alan and I submitted our statement. There was an error on it, and I found out it was an error in my statement, that I immediately amended it, which, in my legal opinion, goes back to the statement, the first statement.
Date of proposal. To the date of the proposal.
To the date of the proposal. Now there's some issue as to whether or not you can amend it, even though it's my mistake, by Mr. Martin's office, and so I therefore withdraw my bid as to the second phase. Appreciate you allowing me to bid on it. I made an error in my bid. It was obvious at the very beginning was an error, because I did the first phase at that price, and the second phase was going to be at that same price. But I respectfully withdraw our bid, and I thank you for allowing us to do that. I'm sorry for the confusion. I'm sorry I made the mistake, but we got issues coming up, and I'm not perfect. The good Lord is perfect.
I thank you for that explanation,
Yes,
Mr.
sir.
Johnson, and that's your privilege to do so.
Yes, sir.
Matter of interest to commissioners.
I got one thing.
Yes, sir, Mr. Good.
The, in the past, one of the rescue vehicles has been stationed at the Lisbon Fire Department.
Yes.
And that it's been a while since it's been there, probably a little over 6 months. And I've had several residents contact me and want to know if we can get it back down there.
With that being
Can't
said,
hear you, I don't know what he said.
Mr. Gooden had indicated that there used to be EMS at the Lisbon Fire Department, and now there's no longer any of the EMS there, and that he's had several requests asking for it to be back. And I must say, to add to what he said, I've had the same request as recent as last week, 2 people in 1 day. I did some inquiring on that myself with Mr. Martin. In my understanding, that identity, as well as others, they're a separate corporation. And they work and serve at their board, even though they get contributions. But I understand there has been discussion with the EMS and that board, but no paperwork has come forth at this time, and I'm just repeating what I was told. But my suggestion to the ones that's called Mr. Gooden, as well as myself, I would talk to your board in Lisbon, share your concerns, and find out what the need and request is, and get back with EMS or the county, because I feel like we, as commissioners, can have some influence with the EMS, and I don't see why they wouldn't comply with reasonable demands from the Lisbon Fire Department. We do need that coverage, and we share concerns that the people that has called in, and I would like to think that that board and the leaders of that board would also be in favor to working and listening with their people that reside in their community. With that being said, that's what I have to say. Is any other comments on that?
Mr. Chairman,
Yes, sir, Mr. Bullock.
are they saying that calls have been missed or delayed time? Or what are they?
The 2 complaints that come to me was concerns, actually, there was a father that had fallen, and the folks were not around at that time to assist the family members, and they could have had a quick response and help had we had the EMS there like it used to be.
At Lisbon?
That's correct, sir.
Can I ask a
Yes,
question
sir.
on that? Are we concerned that the issue that the Lisbon Fire Department does not want to accommodate our EMS being at their facility? What's the issue? I don't understand what's the issue.
That's what was brought to my attention. The actual problems, I really personally don't know, and Mr. Martin, would you like to enlighten us on anything?
That's the concern. Concerns were brought to our attention that they were not pleased with, I guess it was at the time, the condition of the facility. And so that's when EMS stopped being located there.
I can't, this is Dr. Goins. I cannot hear Mr. Martin.
The ambulance was transferred from Lisbon to Clarkton. It's currently stationed in Clarkton now. And there was discussion.
And why?
The Lisbon Fire Department had concerns about, they said trash was left in the facility and that type of thing. There were several concerns. So those concerns were presented in writing. We requested that they be presented in writing, and there was discussion, but at this time, there's been no formal agreement to relocate that ambulance there.
This is Dr. Goins. I just have one concern.
Yes, ma'am.
If the fire department, that we had the issue here at East Arcadia Clarkson area, Kelly, we love to have them on site. The citizens, they feel much comfortable to have the EMS pre-positioned in their neighborhood because they are correct. Their response times are much better, especially now that the fire department do not have first responders. Now, it's okay for them to use the facility, but at the same time, we want them to feel they're at home, they'll feel at home. At the same time, they have to keep it clean. So I don't think that's a reason to move because they used the facility, it was dirty, less trash, just clean up. That's all we ask.
And that's why.
And then we had issues, and I think that could be, so I'm just saying, that's not a reason to move.
And that's what I was saying, Dr. Mungoing.
They were kicked out. They were kicked out.
Yeah, yeah.
Right.
They were kicked out. Okay,
Right.
okay, thank you.
And
But
go ahead, Ms.
where
Peters.
I was on that, I thought they had met and it's been resolved. I thought they were back in there. I thought that David met with you trying to kill your Elizabeth.
Lisbon.
There was discussion back around the first of the year, and there was actually a written document prepared by the Lisbon Fire Department that was presented to EMS, and EMS agreed with the terms on that document, but from there it hasn't been formally approved, and permission has not been restored for EMS.
That's our fault. They've met and they've resolved it. All we got to do is approve it and they can go back.
Who's speaking?
My understanding, Mr. Peterson, clarification from Mr. Martin, that EMS agreed, but from what I understand and from Mr. Martin, that Lisbon has not signed and stated that they accepted what EMS had promised to do.
Okay.
And Mr. Chairman, just to clarify, I'm receiving my information, the Emergency Services Director had a direct conversation last week with officials with that department, and my understanding was, the statement was that until the COVID pandemic dies down, that they wouldn't be making any decision, so.
Did everyone hear that?
So really, Mr.
Yes,
Chairman.
thank you.
Yes, ma'am.
Yes.
Go ahead, Mr. Bullock.
So really, the issue is between the board director for the fire department coming up with an agreement that the EMS can agree with too.
That's right.
So-
And from what it sounds like, agreement's been made, but nobody has signed.
Right, okay.
So I would say, let's get to the table and sign it and keep, the bottom line is it's the people's fire department. And the people have spoken, and they would like the authorities to agree on it. And I think as commissioners, not being disruptive or ugly with our EMS employees, but I think they would see the need that they need to do what Lisbon's request would be.
Right.
And I think that they would respect us for seeing that they honor that request. And so I say that, I say that in defense of Lisbon.
I'm sorry.
Go ahead, Ms. Peters.
I would suggest Greg calls or Nathan calls that advisory board and tell them that people are complaining and move it forward that way.
Can I ask a question, Mr.
Yes, sir.
Of the
Mr. Cogdell.
Is there any liabilities being created by us not having a service there?
That's a good question,
No.
but I would say that immunity, governmental immunity on several aspects would take place, so no, I would not, but I can get
Mr.
more
Chairman.
into it.
Yes, sir, Mr. Bullock.
I don't think there's no liability of us not being there because.
You said not being there?
Yeah. By us not being there, we creating a liability that a citizen can come back with us for liability by
No.
us not being there?
No, sir.
Okay.
Thank you everyone for that. Anybody else have any thing else, matters of interest?
Mr. Chairman,
Commissioner? Yes, sir.
we're on item 4, right?
Yes, sir.
PPE for the fire department's EMS,
Yeah.
how is that coming about? Is that up to par? Or how with that?
Mr. Martin?
My understanding, I haven't heard of any concerns. I know they had offered gloves, and I'm not sure about how many masks they have. I know they had gloves.
Mr. Chairman, this is Nathan. I'll be glad to speak to that issue.
Please do.
All right.
Can everybody hear me?
Yes, sir. Go ahead, Nathan.
Yes.
PPE is very limited throughout not only the state of North Carolina. We were advised Friday and today that we had received about 33% of what the state has requested. As far as fire departments goes, I have talked to a lot of them. They all have concerns about PPE. but I will tell you this, we have not distributed any PPE to any fire department in Bladen County. Now, there are some that have got masks and things on their own. People in the community have made them and taken them. As far as masks and other stuff, we don't have it to give to them, and we've got requests in for about 700 masks, and we have not received it. It's been in for 3 weeks. So what I've advised most fire departments to do, if they're in question, they've all got self-contained breathing apparatuses, like air pack, like you wear in a house fire.
Right.
Those would work. If they're in doubt when they go to a call, I would advise any kind of wreck where they've got to cut anybody out of a car or anything like that, I would advise them to wear that. If they need gloves, rubber gloves, we can probably get them a few of those. I don't know that we can take a whole case down there, but we can certainly get them a few boxes. But as far as N95 masks, if anybody knows where I can get some, I'll sure jump on it.
Well, this is Dr. Mangolan, and my only concern, and I talked to Mr. Bullock about it today. I've talked to not just the one he started, but a couple other volunteer firefighters, and their point is, and I also say the comment, they can use their apparatus, but it's kind of tough for them when they go to a wreck or a site like that. And so a lot of them, I just don't want people to be on a highway and do not get service. It bothers me. So if you have at least the gloves, something that they can get that can protect them, we need to do something. At least a few people, and that would be that same 3 or 4 people that will go out to every call. I'm just worried about the car accidents, especially out in the county or the outlying counties areas.
Yeah, Dr. Mungo, this is Nathan again, and I do understand your concern for those guys. I can definitely get them some gloves, but as far as masks, I just do not have them to give.
I got you.
If I had them, I would certainly give it to them, but I've called around to some people about making the homemade mask that you see a lot of people wearing, and I might get my hands on some of those this week. If I do, I'll certainly distribute it out, but as far as the N95s or surgical masks, we are very, I'm trying to keep EMS,
Stop it. We understand. We understand. And we're working on that now. I have a lady who's supposed to be making some masks for us. She lives in Columbus County. As soon as I get the stuff to her, she'll get them done this week. So right now, we'll use them.
And if you need us to get some stuff or pick it up and take it wherever so you don't have to do that, emergency services will be glad to do that.
The only thing we don't have is the elastic. So we try to improvise. We don't have the elastic. And we cut uniforms to use for the mask. Okay? Well, do what we have to do?
Yes, ma'am.
Nathan, how long do you think if we weren't to get any more masks at this point, how long do you think we would be able to make it before we'd be completely out?
If we keep going like we're going on calls, and keep in mind, EMS is only, they're trying to conserve this. I would say right now we probably, it's hard to say, Ms. Tripp, but I'm going to say maybe 3 weeks.
Okay.
Now I've got a few in the back just in case that I'm trying to hang on to for dear life, just in case we do get to that point. But and that was one reason behind suspending the responder response for the fire department to kind of limit some of that exposure for those guys, because a lot of times they'll be the first ones there on the first responders call before EMS does, and certainly too on wrecks. I know is in a car in a wreck on 87, especially in the East Arcadia area. When EMS gets there, they would have some things they could give to the fire departments, but you know, the fire department's defense, they can't let somebody trapped in a car sit there for 15 or 20 minutes until EMS gets there.
Yeah.
So
sure.
I reached out to them, you know, we're cutting on a car, I know wearing an SCBA would be not as comfortable as having just the N95 mask on. But it could be done with SCBA. I know trust me, I know how heavy those things are and how uncomfortable. Right now, we're got us this week on they're trying to figure out how we can decontaminate the N95s we've got to conserve them. So, and there are some studies that are coming out on that, and we should get some more guidance on that this week.
Thank you,
Mr.
Nathan.
Great, okay, thank you.
My input on this, they should be using the scuba equipment and not the mask until you get a better grip on, you get your hands on the mask. You gotta use what you got, and what you said, I think right on target, that should be the protocol.
Chair recognizes Mr. Bullock.
All I would say is I think we need to take special action, not saying that Mr. Dallas hadn't not done this, but I think we need to take special action to get some PPE here in the county. I don't know what it is or what it takes, but we need to, because I believe he said he only has enough to last for 3 weeks, and that's way below sufficient. So I suggest that we take special action to get some PPE here in the county.
He's already put it in place.
Did you hear that, Mr. Bullock?
What was put in place?
The request has been in place for it.
We've requested PPE from the state 3 weeks ago, and we have not received.
There's nowhere to request it.
I mean, they just don't have it to give, and and I'm telling you just from conference calls and things that I've been on in emergency management, and, Dr. Duncan, I'm sure she's been on some of the same calls. They are prioritizing these larger care facilities that have an influx cases right now, and that's going to be your Wake, Orange, Mecklenburg is the hot spot, North Carolina for it. A lot of those, they're burning through this stuff a whole lot. We are, and we can certainly reach out to the state. And when we put a request in, they're asking, how much do you have on hand? What is your current burn rate? What was your previous burn rate before this started? I mean, it's the whole caveat of questions you have to answer, and sometimes you'll put in a request 3 days, and they might only be able to supply you for half a day. That's just how limited supplies are.
And Mr. Dallison, we appreciate it. I know what you're working through. I told you I ordered some back in February, and I never got them. I just canceled the request. So we understand. So thank you so much.
But I wasn't trying to say he hadn't done his job.
Oh, we understand that.
Okay.
You clarified
To
that.
echo Mr. Dallas, though, I
You
mean,
clarified that at the beginning.
lately, we're reusing N95s at the local hospital, issuing one, trying to clean the best they can. We're looking at everybody that's using them, where before, I mean, it was an infection control that you use one and you discard it. And those days are not today. It's an N95, a face mask is a precious commodity today.
Now, he requested, he went to the state.
It's 3 weeks ago.
Is there anything when you can go to the federal? I don't know.
The federal government needs them just like we do.
Dr. Duncan, can you sanitize it in the microwave?
They've already.
I hear that you can,
It got metal on it.
the linen ones, the ones that are homemade, but not the
Add
N95s.
metal in it?
Yeah, they put one of those.
Any other matter answers from commissioners? If
Mr.
not-
Britt, this is Dr. Wayne Goins. I just asked Mr. Martin for the update with the concern with the trash from in Lisbon. I was at Giorgio's, and another gentleman came to me and asked me the question again. What's going on? What's the status? What
With that
can the
trash
county do
and-
anything to assist them in moving that trash?
Yes, ma'am. As we communicated to you, I know in email format, KIP is in conversation with the sheriff's office, and they are trying to pursue that through the sheriff's office. And so if that's not successful, then in the very near future, the staff determined it would be approximately 2 days for the inmates to pick up that debris, but if it comes to that, I guess they'll have to do that. They were trying to find the.
Thank you.
Dr. Mungoins, according to the ordinance, it's the responsibility of the landowner. But obviously, this is a bad situation in terms of the volume of trash. And so they're trying to work through the law enforcement to find the responsible parties who disposed of the trash there. So they're trying to deal with it that way first.
Okay, I thank you, and I agree, but I think some of the trash is on the easement part of the DOT side as well,
Okay.
according to them.
All right.
But thank you.
Thank you, thank you.
Mr. Bullock?
Oh, where are we at as far as resolving the current year budget, the upcoming budget?
Mr. Martin?
That's one of our big, the big concern with regard to the upcoming year budget is revenue projections. And we don't have any sense of confidence about how to do that at this point. So we just had a webinar with the School of Government last week, I think it was, early last week. And they are recommending that local governments kind of wait. This would not be one of the budget years where the budget is adopted the first part of June. It's going to be more to give time, more toward the latter part of June to give time to have the best information we can to make projections. And so that's a very real concern at this time.
And one other question, citizens have called me, want to know why some department stores are open when beauty salons and barbershops are closed. And they say by Walmart, Walmart has a pharmacies in there, so I know why they're open, but they want to know why some of the stores in town are still open when the others did have to close. Anybody?
There must be an exception. There's numerous exceptions.
I can address that from what I know of essential things, and I'm one of the merchants in town. Mattresses, in my case, bed frames and things of that nature. My understanding about Line Ones, and he has actually a certificate that's been presented to him last week from the state due to safety shoes and safety gear that he sells some of the people in the community. That's how and why he's expected to be open.
Mr. Britt, excuse me.
Yes.
I didn't hear that last statement.
As far as which one? I said as far as...
I heard you. You said because of mattress, but then you said Line was something.
Line Ones put in they asked about their store in particular because Ricky was concerned he wanted to follow the guidelines, and he actually has a written article back from the state stating that he was deemed essential because of safety gear, safety shoes, steel toes for your workers and all. And which I respect him for writing in and getting that request and actually got it back in writing in case somebody questioned it. And, but as far as any of the others, the best thing to do is go online. The commissioners have it, it's available online. It shows you and tells you what essential items are and what stores should or should not be open.
Thank you, sir.
Yes, sir.
How about these car wash? I got a complaint last week that I think it was the Lupitown police, I think, that went to one car wash and then they went to another one and they're full blown. They should be all the same. I didn't see anything on the document that said car wash were necessary. So should all of them be closed?
It was brought to my attention today, and there again, I haven't read it, and it's in town, that it did state cleanliness and janitorial on cars. Now, have I read it? No. Was that what I was told? Yes. So that's all I can tell.
So that's what it is? So I can find that?
I would assume. I haven't read it, and
Okay.
and Ray hasn't looked for it either. And,
Okay. Well, that was a complaint I got, so I'll let them know.
Okay.
Thank you.
You're quite welcome.
They can continue.
Right. At this time, we recognize Health and Human Service, Ms. Terry Duncan, as in Dr. Terry Duncan.
Good evening.
Good evening,
Good evening.
Dr. Duncan.
We certainly have a pandemic going on that nobody in this room, nobody in this nation, nobody in this world ever thought that would be what we are facing today. We have been blessed in Bladen County in that we have only one positive case. We have tested multiple people and are continuing to test according to the guidelines for the CDC and the North Carolina Department of Health and Human Services. Those guidelines do change, and we are expecting them to change in the future based on where we are in the life of the virus. To date, Count is 40,000 tests in North Carolina, with 2,870 being positive, 33 deaths, and we certainly have, our thoughts and prayers are with all of those families that have lost loved ones. There are 270 in the hospital. The Surgeon General yesterday on the news stated that this coming week nationally would be one of the worst weeks. Again, living in Bladen County is to our advantage right now because we have a more sparse population and we're not used to riding in public transportation, and our lifestyles in general are not as congregated. Now, in the event that it was to continue and that we were to have more sick and more hospitalized in a rural area, then it becomes a disadvantage. But as of right now, we're very blessed to live in a rural area. Secretary Mandy Cohan today of the North Carolina Department of Health and Human Services echoed what the Surgeon General said yesterday, and that's stay home. What we do know in all of this is that the one thing that will help prevent the further spread is social distancing, and even now moving the term to physical distancing, because socialization we need, and we've learned to do that a little bit differently, but it's that physical distancing, that 6 feet apart. You know that the recommendation came yesterday from the CDC that if you were out in public and you were anticipated to be less than 6 feet, that you wear a face covering. That's not a mask, that's a face covering. As Mr. Dallas mentioned earlier, face masks are to be reserved for healthcare and EMS, those people that really are going to be around those folks that have symptoms that have progressed and need medical care. So we know that based on what Secretary Cohan said today, the data has begun to come out from the experts, and we know that if we stop, people want to know, well, when can we stop? Well, if we backed off of social distancing, they say by middle to late May we have about 750,000 people infected in North Carolina. And if we continue, then we won't have near that many. So I'm just asking you to heed what everybody has told us. Stay home to save lives. And I've said to the Bladen Journal on Friday, I think it was, before you go out, we really should ask ourselves, is this essential and is it worth the risk? Is it worth the risk not only to myself, but is it worth the risk to who I am coming in contact with and who I am coming back home to? Questions?
Yes, I got one. I get concerned with people. You hear so much about testing that's available. And if you had an illness, how many people has been tested in Bladen County? And if you need to get a test, how you proceed?
Okay. So the answer about questing is the guidelines for questing has changed over the course of the virus. And everybody doesn't need a test. I want you to think 6 months ago, if you had a fever and a cough, what would we normally do? We'd stay home and treat those symptoms. Well, that's what we need to do today. If the fever, the cough worsens so that you need medical care, then you would go to your provider. And then your provider would help determine if you needed a test. Simply going to a provider does not mean that you need a test. The point of testing now has changed a little bit. We know where the virus is. We know that it's community spread. Us testing someone isn't going to change their course of treatment if we're going to test them and send them back home. It won't change their course of treatment. So one of the reasons why everybody's not being tested is because we need to save that PPE, that personal protective equipment, for those EMS, the hospital personnel that again are going to work with the more sicker patients and those that are going to require longer time. And every time we test somebody has to guard from head to toe.
So the number of people being tested, do you have an idea how many have been tested?
Well, we do. Roughly, I can give you an idea of what we know. We know roughly 50 in Bladen County. However, providers are not required to report to us their test unless it is positive. So providers may very well be ordering the test, but we don't know it. When a provider orders the test, they are to instruct the person that they are to go home and to self-isolate.
The question I'm asking, are testing modules, are they available?
Yes, sir.
That's the question I'm asking.
Yes,
If a
sir.
person has, do we have a problem with not being able to test people, or do we have testing material?
We have tests available at our local hospital and at the health department if a person meets the guidelines for testing.
Dr. Duncan, a question is being asked of me now. Instead of 4 to 6 days originally for Bladen County, I think when we were sending it to Raleigh, correct me if I'm wrong, what is the turnaround time now if we test someone, say at the hospital versus the health department?
So right now, if we test at the health department, that's going to go to the state lab. We did get a result within 48 hours from one we just tested recently at the health department. The hospital now is testing with and going to the state lab. Originally, it was somewhere 4 to 6 days, and then it ended up 4 to 10 days. But there is a rapid test now that they're getting a result with in 48 hours, give or take, at the hospital.
Mr. Britt,
Yes, sir, Mr. Peterson.
couple things.
Yes.
Terry, we need to call before we go to the doctor's office.
Yes, sir, absolutely.
You will say it again?
Greg, I don't know if you want to talk about it or if you want Terry to talk about it, but, and you might be going to do it a little bit later on, Greg, but I'd kind of like to have an update on our employee situation.
I didn't understand it. What, can you repeat that again?
You call the provider before you go.
If you are sick, like I talked about earlier, if you have symptoms, that fever, cough,
You clarify.
you stay home. If you are going to see your provider or go to the emergency room, you call ahead so that they can prepare and make arrangements for you, because you might come in a different entrance or you might not come in at all. But you do need to make that call before you go.
That answer your question, Mr. Peterson?
Yeah, I was just want to make sure that was added, but I do want to know where we are around county employees and work schedule and things like that, but Greg might be going to address that a little bit later.
He'll address that under his time of conversation. Yes, sir. Thank you, Doug.
Right,
Yes, sir.
right.
Mr. Chairman,
Yes, sir.
I got one question. How is BART doing their transportation now?
BARTS is helping to transport the meals for the nutrition site. And if they are transporting a client, then they are cleaning in between based on, again, the guidelines there, and they're doing an excellent job.
So are they picking up individuals and transporting like they normally do, or?
Only for those needed, like again, is essential.
Okay, thank you.
Okay, Dr. Duncan. Item number B.
Okay, I want to take one point of personal privilege before we leave
Sure.
that one. This is National Public Health Week, and I just want to say that everybody in Bladen County has been a public health practitioner in the last couple of weeks, and I am so proud to be living in a community in a county that has taken this so seriously, and I just want to say thank you.
Thank you.
So our next item is the consider approving the North Carolina fiscal year 2021 consolidated agreement. This is one of those that helps us get our funding from the state.
Need a motion?
Motion to approve.
Motion by Mr. Gooden, second by Mr. Dallas. Any discussion? All in favor say aye.
Aye.
Opposed?
Aye.
Gotcha. No no's, correct? Item number C.
Consider approving the contractual agreement with Nutrition Plus. And this is for our WIC program.
I so move.
Second.
Got a motion by Mr. Bullock. We got a second by Mr. Cogdell. Any discussion? All in favor say aye. Aye. Opposed?
And then lastly, to consider adopting an updated fee schedule.
Motion to approve.
Got a motion by Mr. Gooden. Need a second?
This This is to help improve payment or something like that?
Yes, and we looked, it had not been updated in
Hold on
quite a
just a
little
minute.
while.
Dr., we got a second by Mr. Cogdill. Any discussion? Now, here you go. Ms. Wilson.
We did look, it hadn't been updated in a while, and our new supervisor for billing, as well as our clinical folks got together, and we also looked at the surrounding counties, and this moves us more in line with surrounding counties as well.
All right, thank you.
All in favor say aye.
Aye.
Opposed?
Aye.
Thank you, Dr. Dunn. Emergency Services, and Mr. Dallas can come in, please. Nathan, you gonna speak from there, or you coming in? There you go. You could have done it from there, whatever you want to do.
Wow. Sit here.
Well, no, well, just be sure they can hear you.
Okay, the first item is considering approving our contract for the expedited acquisitions on HMGP Florence for Holland Consultant Planners. And this is the company that's done our HMGP for Matthew also. But this is for the 5 expedited acquisitions.
I need a motion.
Motion to approve.
Motion to approve.
I'll second.
Second.
Got a motion by Mr. Gooden. We'll take the second by Ms. Trivett. Any discussion?
Yeah, I just have one question. This is Dr. McGowan.
Yes, Dr. McGowan.
On those, and I'm sorry for asking now. Are these the same, a couple of those that had several deeds or had to revisit?
These are coming up, items C and D, those are.
Oh, okay, thank you, okay.
All in favor say aye.
Aye.
Opposed?
Aye.
Thank you. Leave Mr. Dallas.
Yeah, item B is consider approving professional service agreements regarding hurricane, and this is also Hurricane Florence expedited. This is when we sent out the RFQs and Ps for the professional services such as surveying, attorney fees, or attorney services, asbestos abatement, and surveying. So you'll see on that document.
I need a motion.
So moved.
Motion by Mr.
Motion to approve.
Got a motion by Mr. Gooden, a second by Mr. Dallas. Any discussion? All in favor say aye. Okay, so hold on a minute.
Aye.
I got a discussion.
Okay, hold on, back up just a second. Mr. Cogdill's got a question.
When I was looking at that, and I was looking at how we solicited those proposals that come in, and when I was looking at the different services, and you had to meet the standard of 400, and it had something talking about years of experience, how long staff, and all that. And then it did something, this caught my eye, and is that I looked at it when it got down to legal fees. Is this something that we're getting ready to enter into now with these federal contracts, that it has to be handled through this type of a bid process? Or just to be handled from this point on? Because only reason I looked at the attorney with Walmart coming in on it.
That's line item E, is it not? Not B.
No, it's in B in the
Right,
document.
B and E as well.
It's in B.
Yeah, B.
And I was looking at that, and I was trying to figure out, why would we go out for an outside attorney, and who's handling the acquisition of the other properties and closing on the other properties?
So Johnson Law Firm handled our acquisition attorney services for HMGP for Matthew, and they're continuing. I mean, we got some going on. Actually, item C and D, they're actually doing the agreements on those. But each grant, there's a different grant number for each little. This is kind of what Mr. Johnson referred to earlier as the second phase. So the first phase, we sent out a bid for professional services, surveying and all that. They won the bid for the first go around. The second go around, you'll see Walmart and Campbell, and there'll also be a third round coming up.
This is for 5 of them, right?
This is for the 5 expedited only.
So what I'm saying is, from this point on, every time someone get ready to handle legal fees on these HB, whatever you got,
HMGP.
they will be out on a bid process.
Yes,
They will
absolutely.
go out to a straight bid, and who come in with the most competitive bid. So that's
Well,
what it is.
it's price factors into it, but it also, locale or experience of handling, grant funds when it comes to disaster relief for stuff like this. The other criteria was familiarity with Bladen County, and there was one more criteria. And when they submit their bids, like Johnson, Womble, Campbell, the surveying companies, asbestos, they submit in there, I've done this in the past for Bladen County or Columbus or Pender. I've been doing this for 30 years. And you know, you kind of grade it on that. I'll have these done, you know, like appraisals, they'll say, we expect to turn around one appraisal within 5 days. Well, one might submit, we expect to turn this around in 2 days. Well, obviously the 2 days gonna get a higher point value than the 5 days.
Okay, the only reason I was bringing it up is just being straight across the board. I looked at, that's the city, Elizabethtown County Attorney. And I didn't know whether this process was opening up a door where Johnson could bid on city stuff for the city. Okay, they bid the other grants out.
If the city has something out there and they solicit bids for services, Johnson Law Firm could certainly bid on that.
But so these houses, this issue that we dealing with, the housing, won't be handled through the city the same way.
No, this has nothing to do with the town of
That's what you
Elizabethtown.
said. So this is just all straight.
This has no bearing on Johnson Law Firm and still the county attorney. This is just strictly for these 5 they'll handle the title opinion and closings and all that. That just on these 5.
I didn't know.
And we'll have another one come up probably in the next few months that we'll have to send out for bid again, and then Johnson Law Firm or somebody else might win that, might be
Okay,
awarded
I just
that.
want to know when we get ready to start the process with it, all this stuff gonna be just.
That has
bid
no
out.
bearing on any
And that's why
other.
Leslie withdrew earlier.
Yep.
Our proposal for this line item B right here, because it was a clerical error.
Yep.
And he bidded the same price we did last time, but on 2 different sections. So
So
because
the next section will be where you back into the business, it'll be an open bidding process.
Yep, the next phase that'll come up, that'll be the Florence normal acquisitions and elevations. And we'll submit that out, and there should be roughly about 30 or so properties in that.
So how much weight does the experience in this cover?
So it's a point scale. I don't have the forms in front of me, but we sit down as a group. I want to say the 2 that put in bids, and with respect to Mr. Johnson, he withdrew his bid earlier. But I think everything was across the board until you got down to where they made the clerical error.
On the cost factor.
Yeah, because it all experience, I mean, obviously we all know that they've got the experience, and so does the other law firms.
The only thing I was just trying to get clear, when we getting ready to start into a bidding process, I didn't know we was doing that.
We have to bid these out because we're getting, the federal dollars come down from the state. This is actually FEMA money we're dealing with on this one. So, we have to go by the most, if our guidelines are more stringent than the states or the federal government, then we go by ours, but the county kind of follows the federal guidelines on bidding out that product, so we have to follow those guidelines.
The only reason I was
I
asking was gonna be conflict with the city dealing with county funds and coming over here dealing with our funds, that's the only thing.
No, this is totally separate from what they've got contracted with the city.
All in favor say aye.
Aye.
Opposed?
Aye.
Okay. Item C.
So item C is consider approving a sales agreement and contract for 16693 NC Highway 211 East. This is a HMGP acquisition, and you can see on the documents attached, homeowners already signed. And we've been signing these in the past as far as emergency management. We did the due diligence stuff for y'all, but I wanted to bring it to the board's attention so you would know before I sign this document.
Motion to approve.
Motion by Mr.
Motion to
Caldwell,
approve.
second by Ms.
Second.
Trivett. And, any further discussion? All in favor say aye.
Aye.
Opposed?
Aye. Aye.
Item D, exact same thing as the 211 property, just bringing it to your attention so you know that we're getting ready to acquire that property, and we'll do the closing, and I'll sign this sales agreement, and then we'll move forward with Johnson.
Motion to approve.
Got a motion by Mr. Cogdell,
Second.
second by Mr. Bullock. Any further discussion? All in favor say aye.
Aye.
Opposed?
Aye. Aye.
So moved.
I'm gonna go to the chair.
Item E, just to make you aware, and some of you might already know, one of my employees has put in their notice. This Wednesday will be his last day. So with that being said, we sit down, I sit down and try to look at how we could become, as emergency services, more efficient and try to save a little money at the same time. I know you've got a document attached, so what I'm proposing, and we can kind of, and I can break it down more if I need to from what you've got as a summary page, but what we're looking at is restructuring emergency services technician position, which is the position that's leaving. And you'll see his total package, that's salary and all benefits, total pack. When I say total package, I would like to take my part-time, I would like to reclassify that emergency services technician, just change it, per se, I won't say do away with it, but just restructure it and make the admin assistant that we have now full part-time, make it full-time. So, and then the address and duties that that person, the emergency services technician will do, I've spoke with environmental health and the admin assistant one that they've got over there. To me, it makes more sense because the way the process works, not to get all long and drawn out with you, is now you go to environmental health, you apply for your PERC test. Environmental health goes out and applies for your PERC test, and we've got a system that's iWorks. The admin assistant over there puts a point on iWorks. Once that CO passes, they come in, they pay for their CO. She calls the emergency services technician. Hey, I need an address assigned. Then she calls the person back and assigns their address, and we write them a letter. So it's kind of scattered out. So it makes more sense. She sees the customer in the beginning and the customer in the end. She already knows, they've pointed out to her where it's going to be at. So we could certainly give her, Jeff Colby works with us, could give her the capability to assign that address right on the spot. So that's where you'll see the reclassify admin, the $3,000. We would reclassify her.
There's crayons in here. Yeah, just grab your crayons. I'm in here, baby. I have to do this.
But anyway, what that would do is give her a little increase for the increased duties with addressing. So the next line item you bring down, it says reclassify part-time position. Right now we've got an admin assistant that is part-time. She's 20 hours a week. So what I want to do with that is change that to a part-time maintenance / grounds for the training center. And what that person will do is maintenance grounds, keep the grass, keep everything clean after all the classes we've got going on over there. They would also make the road signs, the actual signs you see. I've talked to the sheriff and he's agreed that the inmates would be able to put up those road signs. So I've talked to all parties involved. By the time all that's said and done, total, it's going to save the county $1,954.59. I know that's not a lot, but it is a savings. So I just want to propose that to you all, and thoughts, questions, concerns.
What you said is more functional and makes it a lot
It's more functional for us. I mean, obviously in a perfect world, I'd like to have full-time everybody doing everything, but you know, we don't have the capability to do that now.
The one question
All right, this is Dr. Wayne Goins. I have a question. Did we not give you another person recently? And did you not reclass or switch some other position to part-time?
Like, we hired an admin assistant part-time.
You got that person part-time, right?
Yes, part-time right now.
And that's what you're asking now, to make her full-time, him or her, full-time?
Yes, ma'am, we would have to open that position up again, but yeah, I would like to make her full-time to replace the emergency services technician full-time.
How many full-time emergency technicians do we have then, now?
He's not adding, Dr. Mungowens, he's dropping. We got one resigning.
I know he is, that's my point. How many do you have now, is what I'm asking?
Well, I've got one, and he, as far as that job title, emergency services technician, if we make these changes, will be none.
And you didn't need one, so you didn't need that position.
I did need that position, but we're splitting. I desperately needed that position. But what I'm trying to do is make us more efficient. Because, and I'll tell you why, a lot of this grant stuff that we're dealing with, that is about 85% of my time. HMGP, DRA 17, and all of the plans and things. We're in the process of writing a mass feeding plan, and my admin assistant is heavily involved in that. And not that
I understand.
okay.
I understand that because Matthew and Florence have put a damper on your position. I understand that.
Yes, ma'am.
So once that's resolved, then what would that person do?
Day-to-day duty, I mean, just the admin work that I do, paying bills, making edits to plans, submitting all the documents that we have to submit to the state. I mean, there's several, she'll have he or she, whoever would get that position, if y'all grant it, would have plenty to do.
Okay, I'm not going to knock that with you. I think you know your job better than anyone else, so I think you need that. But my only concern at the same time is, did we not switch or split that position that you had and gave the fire stuff to someone else for that reason?
Not Alicia Evans, when she retired, we restructured that position about 4 months, and that's when Jeff Culp was moved from a IT department to emergency services department, and he now does IT for the sheriff's office, Robin, and emergency services.
Okay, I can't see the big picture, but okay, I know I'm going to take your word and I'm going on. Thank you so much.
The first I'm asking on this is, Mr. Dowd, you are not going to reduce your staff at all. It's going to be the same staff.
Same staff, just different
and you're going to still have a full-time and a part-time.
Right. Yes, sir.
You're just going to reclassify them doing different things.
Yes, sir.
So if a situation arises and you just need the actual physical people there, you still have the same availability that you always had. Because I remember we was hiring people to come in and do grant administrative work.
Yeah, and all that's
they have all this
dissolved
stuff. So you're going to now consolidate this with that administrative system to handle all that grant stuff.
Yes, sir.
And the part-time person is just going to be there just to do miscellaneous stuff throughout the facility.
Maintenance and grounds, EM stuff if we need it done, array of things.
So you don't need to increase that up to full-time.
I would love to have that person full. I would love to have I'm not gonna lie to you and tell you I would love to have a full-time ground and maintenance. I'm just trying to best suit our needs and keep us within the same money that we have already allotted.
And you hadn't asked for any more money.
No,
You're just trying to be more efficient.
I am trying to be more efficient. Now, if I sit here and tell you I couldn't use it, I'd be lying to you, but I'm trying to work with what we got.
That's what I was asking, because we come in and you say you need some additional staff, and we can give you additional staff, but I'm saying, if that person's half-time, I'm trying to figure out why would we want to just start shifting stuff around. I was trying to get a clear understanding.
Well, right now, when it comes to taking out the trash and cleaning up, if there's a maintenance issue at the training center, we do get help from our operations now, but a lot of times it's us that does that. The cleaning up, the mowing grass, I go out there and mow grass, and the sheriff's office helps with that also, the guys that are out there.
Now, here's the last word I'm asking.
Okay.
With all this trash and cleaning up, who generates all that? It ain't but two of you guys out there. Who's generating all this stuff?
We have classes out there. We're housing the CDBGDR intake center for 2 counties at the training center. All that, stuff's got to be, there's meetings out there constantly, Marines train.
Well, I'm asking, do you get any compensation from anywhere for any of that stuff that goes on?
The only compensation we get now is from CDBGDR. They pay $1,000 a month. And what we do to that money is move it into the maintenance and repair of the facility to make maintenance and repairs we have out there.
That's what I'm thinking. Like, I know
but that could end any time. That could end tomorrow.
I know they could be doing all the state troopers and all this stuff. Be going to ask them, is any money coming in where they offset any of that cost? That's what I was asking.
No, and a lot of times, we'll have the wildlife and stuff for the state. We do have USDA out there, and they pay a fee every month. We house them out there. They have.
We don't have. Do you have a fee schedule for people to do anything out there?
Right.
How do they go about paying you?
They don't pay. Most of the time we have classes or fire classes we have out there because we've got the training tower and everything. Fire associate meet time to time. There's county meetings.
state crews out there shooting every day and
Well, when they're using our place as a right, if they're shooting, they're back on the firing range, and that belongs to the law enforcement.
so I said, but do we have to pay any, when they do training, do they give us any compensation? That's
No,
all
sir.
I'm asking.
And 90% of the time, the training that goes on out there is administered through the college. So,
They don't compensate you anything.
Mr. Britt,
Yes, sir.
you know, I don't really have no problem with what he's proposing, but you know, we just hired a man at the sheriff's department to help with that grass and stuff, and I would have rather seen us utilize that and then come back and say it ain't working versus doing that. But you know what, the college and these people use these facilities, we need to put some type of cleanup list on there when they leave our training facilities. They do things like that. I know when you rent the historical building in Blackbird, there's a list of things you've got to do before you leave.
That's what I'm saying.
I mean, that would help a lot. We're not in the business of cleaning up behind people, or we shouldn't be.
That's what I'm saying. Ain't give no conversation, we was over the cost.
and that's not the only thing they would do. I mean, we do, when we know, we've got a calendar that when people use this and they're well aware of what they're supposed to do, we give them a paper. But we do go in behind them and we do find trash, and we try to vacuum and mop and keep the bathrooms clean.
Well,
But there's a
what
number
I'm
of,
telling you is we need to hold people accountable if they're going to use our facilities. And when we find that, we need to call someone and tell them.
Mr. Chairman.
But at the same time, I think they should pay, because if they're using the facilities and the resources, why don't they pay part of it? Nothing's free. So why does the county have to pay for everything that folks come in and use it for?
Mr.
Well,
Bullock.
we're not going to charge community college. We're not going to charge fire training. We're not going to charge EMS.
Why not? It should be in the budget for them.
The chair recognizes Mr. Bullock.
Only thing I was gonna say, is it possible, and this may be way out on the limb somewhere, that whoever using the facility could sign some type of agreement, and in that agreement, we put in the agreement what their requirements are? Is that feasible?
I understand your request, but my comment and remark to Mr. Dallas, this is his department. He's cut it $1,900. It's his responsibility to get everything done. It's got to be done, and it should be up to him to restructure to the best of his ability, because he's got to be accountable, and he hasn't asked for no other money. So I call for a vote. All in favor say aye.
One more comment, Mr. Britt.
Yes, sir.
I know it's his department. I'm not trying to micromanage his department, but there's things that can be done to help him and help that facility stay a little cleaner. Because I know I personally talked to Dr. Lee, and she said she'd do whatever she had to do if they were leaving her, when they left there, if they were leaving it unfit.
Right, and I think this has been brought to his attention, so I think he'll address it. Okay. All in favor say aye. Aye. Opposed?
Aye.
So moved. Thank you, Mr. Dollar.
thank you.
The inmate's not coming to that now.
We get the guy we hired one day a week.
You still getting in there?
Well, we haven't got him yet.
I need a motion to enter the session of Bladen County Water District Board of Directors. Got a motion by Mr. Gooden, got a second by Mr. Priest. Consider yourself in the water board.
Mr. Chairman, I'll be glad to speak to this.
Yes, sir,
matter.
Mr. Mark.
The board is requested to consider approving an LGC application related to the Phase 4 project that was approved by the board at the previous meeting.
Motion to approve.
Got a motion by Mr. Cogdell.
Second.
Got a second by, is that Dr. Mungoins?
Yes.
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 By Dr. Mungoins. Any further discussion? All in favor say aye.
Aye.
Opposed?
Aye.
Okay, so moved. I apologize for some of y'all the seconds or motions, because you're coming in after the fact. You're a little delayed behind us, so I apologize for that in case you question, you know, not understanding.
Motion to exit.
Yes, sir. Okay, got a motion to exit.
I second.
Second.
Well, hold on a second, please.
Mr. Chairman, I'm sorry to interrupt you, but if we could, it was just pointed out to us, and I knew I didn't have anything written down. Item E did not receive a motion and a second. There was a vote, but the clerk didn't record a motion and a second. I didn't either.
6E?
Yes, sir. Do you have one?
I think I made a motion on it.
Yeah.
I made a
Who
motion
was
on
it?
Yeah, I think,
I
Mr.
can't
Bullock
hear.
made the motion.
I can't hear very well.
And Mr. Cogdell seconded.
Okay.
So we got it. What it was, though, to clarify to you folks, there was a question if there was a motion or a second on 6E, and we just clarified that and got that taken care of.
Thank you.
Yes, sir.
Okay,
Thank you.
thank you. Okay, thank you.
We got B coming up under the water board also.
That's what we just,
He just did
Okay,
that.
we got B and C taken care of.
See, motion to
I
exit
just
water
made a motion
session.
to come out, and I
All right,
second.
we got a motion by Mr. Bullock to exit water board, and we got a second by Mr. Cogdell. Any further discussion? All in favor say aye.
No.
Opposed?
Aye.
Thank you. Revenue Department, Ms. Davis.
Good evening. On the number on A, we have property that was foreclosed by the county of Bladen in 2019.
Could you hear Ms. Renee?
Oh, I'm sorry.
There. No.
All right, she's gonna do it again.
Okay. On A, we have considered to accept a bid for property located off of Highway Highway North Carolina 11. It was foreclosed by the county in 2019, and the offer was $4,675. And investment to the county was the same.
We got a motion by Ms.
Motion to
Cogdell.
approve.
Second.
We got a second by Ms. Trivett. Any further discussion? All in favor say aye. Opposed?
Aye.
So moved. B.
Okay. As you remember, during the planning session on February 12th of 2020, the board agreed to establish an interview panel for the 2022 reevaluation vendor selection. The panel interviewed 3 of 7 responders that submitted bid proposals for the Bladen County reevaluation. The panel was completed the interview, and the selection process. And tonight, I want to consider approving the panel's recommendation to enter into an agreement in the amount of $565,000 with Pioneer Appraisal Incorporated for the 2022 reevaluation project.
Motion to approve.
Got a motion by Mr. Bullock.
Second.
Got a second by Mr. Gooden. Any discussion? All in favor say aye.
Aye.
Aye. Aye.
Opposed? So moved. Thank you, Ms.
Thank you.
Advisory Board appointments, Keep Bladen Beautiful.
Motion to table.
We got a motion to table by Mr. Cogdell. Any second?
Second.
Second by Mr. Bullock. Any further discussion? All in favor say aye.
Aye.
Opposed?
Aye. Aye.
Advisory Board appointments for consideration during a future meeting, Bladenboro Fire District Committee 3. So keep that in mind for Bladenboro Fire District. They're gonna need 3. County Manager, Mr. Martin.
Thank you, Mr. Chairman. I'd like to begin, if I may, by just updating you regarding county employees and the work that's been taking place over the course of the past couple of weeks since we last met. Employees have been working diligently, providing critical services, as you well know.
Excuse me, I cannot hear Mr. Martin. I do apologize.
Here you go, come on. You might, you stand right there, you stand right here, you stand right
Let me get a little closer. I wanted to let you know that county employees have been working diligently over the course of the past couple of weeks since we last met. And we've determined that the county is, as you all know, provides essential services. And so therefore, county staff has continued to work. You all will recall that county offices were closed to the public 2 weeks ago today. And so that helped to minimize traffic in the offices. We're also fortunate in our large department, the largest department, which is DSS, that the vast majority of employees work in individual offices. And so they have the physical distancing, as Dr. Duncan referred to earlier. I wanted to let you know we've had several employees who have been required to self-isolate, and so we appreciate them doing that. Fortunately, there have not been any positive tests related to those. We also have employees who are working from home. Currently, we have 6 employees at DSS who are teleworking. the IT staff is working to expand the VPN to allow additional DSS employees to work from home, and so that will greatly enhance the opportunity for additional employees to telework. I wanted to let one point that will be important to you. There has been an emergency sick leave policy that has been adopted by the federal government, as well as an emergency Family and Medical Leave Act that has been approved by the federal government. This provides employees for an additional 2 weeks of paid leave without the required use of sick leave or vacation or other type of personal leave. And so that will be, if it's needed, hopefully it won't be on a great scale, but if it is needed, then that is certainly a benefit for county employees. I was trying to think.
Mr. Martin,
Yes, ma'am.
this is Dr. Langone. I know you talk about DSS, Health Department, but how about other departments that can work from home, the administrative side? Have you considered?
There have been, if I'm not mistaken, the Division on Aging is moving in that direction as well. And so as it deems necessary, fortunately we're able, as I indicated, we're fortunate to have separate offices for individuals. We don't have instances in which multiple staff members are working like in a large office with cubicles or whatever, so they do have the physical distancing. If that becomes an issue and there needs to be that type thing looked at more closely, we certainly can do that. And as you all hear of concerns or matters of interest from employees or others, please don't hesitate to share those with us.
Mr. Chairman.
Yes, sir.
Mr. Martin, I got a question. Now, no one is from the public is entering the DSS building now.
No, sir.
Good.
That's right. And Mr. Bullitt just asked if anyone is entering the DSS building, and the answer is no. I did want to let you know that the staff at the front desk will go to the front door if necessary and speak to any customer who comes to the front door and doesn't realize that the office is closed. They also have developed locations outside, similar to real estate, how real estate companies have these flyers. Look at the boxes where you can pick up the flyer. So they have forms.
Right.
Ms. Smith was mentioning to Dr. Duncan and me earlier today that the demand or the interest in the emergency food stamp program, that type thing, had increased significantly. So they are seeing an uptick in that. But folks are staying busy and working hard, and we certainly do appreciate everyone's service and dedication.
This is Dr. Langone. How about the young men who are going out to do inspection? How about them? Because I know.
Say that again,
they have masks, because they're telling us that if we go out, have a mask, something on, protection.
Repeat that.
But those guys are going out to different places. Any instructions for them?
Say that, Dr. Mungoins, what was the beginning of your conversation again? You said young man. We didn't get it.
The young men that are going out to do inspection, like Corey Hare, Stephen, Matt, those guys. And then they come back in. So you have Sally and Delphine in there. So what protection do we have for them?
We will, I know the conversation related to masks has really picked up here recently. We'll follow up with, they do have masks available to them. Mr. Nathan Dowse just informed me they do have masks available. And so that's a positive thing.
Okay.
So,
So, Mr. Martin, is all our employees' child care taken care of? You know, the salaries is already embedded in the budget. It's already been approved. And we need to be doing everything we can to accommodate our employees. If we have employees that are scared or have fear of coming to work, then we really need to sit down and look at individual cases. And we need to make sure that we're protecting our employees.
Right.
Even though the doors are closed to the public, they're still working together.
Right.
Mr. Martin.
Can I add one thing? This is Dr. McGowan. I know there was one at one department. She left early because of her age and because of her other medical issues. Instead of her, she was taking leave, personal leave, and sick leave. Has that young lady been given the opportunity to work from home?
I don't know if I know who that.
Mr. Martin, I can talk to you tomorrow about
Yeah,
it.
that, if you would, I was gonna say, I'm not sure if I know that specific case, but if you don't mind,
Okay.
that'd be great. Thank you.
Mr. Bullock?
The only question I have, if I need to drop off some documents regarding an application that I've completed DSS, do I mail them in, or is that a Dropbox?
If I'm not mistaken, there's a Dropbox.
Okay, good.
Yes, sir.
Okay.
If there,
It
any
just-
other questions? If there are no other questions, if I could ask you to consider canceling the April 20, is that 20?
Yes.
The April 20th meeting, it's a regularly scheduled board meeting. I will say, and Mr. Bullock asked about it earlier, budget is in addition to this COVID-19 issue, the budget is also high on our minds right now, and we're trying to get a sense of that, particularly in relation to revenues. We will need to have a meeting with the board, if not the latter part of this month, definitely the first part of May. So we'll be in touch with you in the very near future to schedule that. I'm not sure exactly what type of format will work best for that, but we'll need to determine that.
Mr. Chairman, I got one question here that I know we can't meet unless it's 4 of us, no more than 4. I'm trying to figure out how can we have something like a conference call where it's 4 of us on a meeting and we can be updated on things at a weekly point, where you can just call us at a certain time, 4 of us can get on a conference call.
Right, well, I think,
and know what's going on.
at this point, y'all know what I know. They do a pretty good job, I think, a real good job as informing us with the emails.
Okay, but sometimes, you know, with all those, if you got 2 or 3 of us on the line, you can kind of have a more of a dialogue with what's going on than just reading the email and just pinpoint. I'm just saying this is a way just for us to, like I say, it's not, you know, social media. We got to be sociable. We got to be able to talk to each other. I'm trying to figure out if we could just situate something.
Yeah, Mr. Martin, you can work on that?
To that scenario.
Sure, be glad to do it.
Mr. Chairman.
Yes, sir, Mr. Good.
Motion to approve canceling the.
We got a motion by Mr. Gooden to cancel the
Second.
April 20th meeting. We got a second by Mr. Bullock. Any discussion? All in favor say aye.
Aye.
Opposed? Okay, Mr. Martin's got one other comment to make.
Thank you. I just wanted to clarify for the board's information, you may or may not be aware of this. Counties in North Carolina are required to meet once per month, whereas towns are only required to meet quarterly. So that you may see that some towns cancel their April meeting or whatever. Boards of county commissioners in North Carolina are required to meet one time, and so this satisfies that for the month of April. So I just wanted to share that with you.
Thank you.
Correspondences.
Mr. Martin, so if I'm a county employee and don't have any leave, I still get the 2 weeks?
Yes, sir.
14 days, yeah.
14?
And then the advanced sick leave beyond that.
That we voted on last meeting.
That means we have a month.
Under correspondence, I'd like to thank Mr. Martin and his staff and the department heads. I know Mr. Martin has spoke to me from time to time, and he will meet with the department heads on their hours of work and the concerns. And I get calls from some of the employees. I immediately will call him, and it seems to be rectified right off the bat. And there will be concerns, but I think they've done a good job addressing them through the health department with Mr. Duncan or Dr. Duncan and Mr. Martin and the other department heads. So I commend them, and I commend all of our staff with our county. We need each and every one. We consider everybody as essential and equally as important. So, and I say that for all of our commissioners. We're proud of each and every one. With that being said, Mr. Martin has another comment.
Thank you, Mr. Chairman. I just wanted to mention to you all, and I was just thinking about Mr. Cogdale's point with regard to pertinent information and timely information. We want you to have that. We do have a conference call each weekday at 11 a.m. I'm not sure if you all have that number, but we'll send that out to you in the morning. And welcome you to call in at 11 o'clock, and you'll receive the most timely information from emergency services and the health department. And a number of agencies are represented on those calls, so we'll share that tomorrow morning as well.
Okay. Motion to adjourn.
Okay.
We got a motion by Mr. Bullock to adjourn.
Second.
Got a second by Mr. Gooden. Any discussion? All in favor say aye.
Aye.
Opposed?
Aye.
Thank you all and stay healthy.
Thank you so